This is Dr. Paul Thomlinson from Compass Health Network, and I'm doing a continuing series aimed at inspiring hope and promoting wellness during these troubling times we're living in and living through. This episode is a special one for Veterans Day, aimed at shedding some light on some of the behavioral health issues of military veterans, from the impact of military service on mental health to problems in accessing mental health services to the stigma surrounding behavioral health problems among service members. But really, this is more of an appreciation than a deep dive into the research. I'm hoping to make this a series, though, with another episode or two in which we hear from those who have lived experience of both military service and mental health challenges that resulted. I hope you'll allow me to be more personal in this episode than usual because I come from a family in which 3 people, my dad, my big brother, my namesake nephew, all served in the military, and I want to share some of my thoughts about them from the perspective of one who saw the impact and aftermath of their service. Now, we lost our dad, Jewel Thomlinson, when I was 17 in the middle of my senior year of high school. How can a kid growing up in the presence of a figure that is literally and figuratively larger than life have an accurate understanding of that presence? They can't. I didn't understand why he was given to fits of temper, during which he would say harsh things he obviously didn't mean, and then be reduced to a weeping heap of regret moments later upon reflection. How could I understand the relentless and consuming guilt, the sleepless nights, the periods of implacable downheartedness in a man that was dispositionally cheerful and who was known as the life of the party when he was a younger man? I mean, we could see that more innocent look in the pre-deployment smile in his army portrait. Well, of course, I really couldn't understand, not truly. It wasn't until much later in my life that I began to understand the enormity of what had happened to that 20-year-old young man who left the farm in southeast Missouri, got on a boat, and went into fierce and brutal combat in a 40th Infantry Division tank crew in Korea. He sacrificed his innocence, many aspects of his spiritual and emotional and mental health, close friends and brothers in arms, and a precious year of time with his brand new family. For you, for me, and for every one of us living and moving and breathing in a free America. I'd give anything to be able to look him in the eyes today and tell him, I kind of get it now, Dad, that I'm so proud of him and that me and all my friends want to thank him and wish him a happy Veterans Day. I also have to confess I have a case of what I've taken to calling uniform envy, and it flares up every year around Veterans Day when we're reminded of the sacrifices made by those who have worn the uniform of our country. I gave serious thought to joining the Air Force when I was in high school, but the plain fact is I didn't, for a number of reasons. So I've never had the honor and privilege of wearing the uniform of our country. And I now realize that my uniform envy may really be a reaction to survivor's guilt in disguise. All 3 of those close family members I mentioned, all of them are gone now. But I got to see the mental and physical health effects of their service up close and personal while they were here. More on that later. Why didn't I give at least a few years of military service to my country when my dad, Jewel, served in unimaginable combat conditions in Korea at the tender age of 20? Why didn't I pony up to stand on the wall during the Cold War like my big brother Mark, who sacrificed creature comforts and innumerable other opportunities for 16 years to ensure our nation's freedom and safety? Why didn't I choose to become a military psychologist and serve more closely to help those brave service members who have given so much in the seemingly endless war on terrorism, like my nephew Michael Paul did? Well, I don't have a good answer as to why I didn't choose to serve, and I think I'll always feel somewhat guilty that I didn't. I think I'll always envy the well-deserved pride felt by veterans, the kind that comes from answering a call and putting it all on the line. What might have been is a powerful specter. But what I do have is a heart full of gratitude, respect, admiration, and undying love for my family and friends who've served in my place, in all of our places. I hope this episode is in some small way a tribute, an education, and a call to empathy and action to understand and meet the mental health needs of our service members and veterans. So let's launch into that subject. There's an old psychologist dad joke that asks, how many psychologists does it take to change a light bulb? Well, only one, but it's got to really want to change. In other words, for folks to get help, they have to both recognize they need it and be willing to ask for it or seek it. We probably should begin also by acknowledging a widely held observation. Soldiers are not good at asking for help. When I say soldiers, please know that I mean to be inclusive of sailors, airmen, Marines, etc. But that's what all of my family members were, soldiers in the U.S. Army. Soldiers wear camouflage so they can hide in plain sight. They learn their lessons well, and they learn to keep doing that, because they very often do the same thing with their difficult emotions, their grief, their depression, their trauma reactions, and with the other struggles that often follow their proud service. Another observation that's widely held but less spoken of: it could be that no one who goes to war ever really fully comes home, not in the full emotional, psychological sense. Some make it back mostly, which is an amazing and happy fact. Most make it back and yet feel diminished or even damaged in some way, which is fully expected but still not acknowledged as widely as it should be, I think. As one of the battle buddies of my nephew, whose name is Josh Moran, the battle buddy that is, said to me at my nephew's funeral, the Army has a way of turning young men into old men. And so some return physically and are forever unrecognizable psychologically in some ways. This is the unspoken risk our warriors take when they leave us to fight. We worry about them losing legs or eyes, but we still don't fully grasp the danger in which they place themselves, their psyches and their souls, for our benefit. So we owe them a debt of gratitude and a duty of care. And that's what I want to get into for the rest of this episode. There are roughly 19 million veterans living in the U.S., and we know from national estimates that about 20% of veterans have a mental health problem. This can include a whole range of conditions, such as post-traumatic stress disorder, PTSD that is, but also depression, bipolar disorder, substance use problems, and others. What about the improvements in care for our vets? Are we doing better? We're going to talk about some of the barriers to getting care in a bit, but I want to first say a word or two about how we are getting better at caring for them. A lot of organizations like Compass Health Network are working hard to increase the capacity of our mental health care professionals to really deliver high-quality, evidence-based care. That is, services that are backed up by scientific evidence that they actually work. For example, one of the things we're doing is we have a special committee, an energized task force, aimed at this very thing at Compass, to improving care for veterans. And thankfully, we've seen certainly large investments from the federal government for both the Department of Defense and the Department of Veterans Affairs to expand their clinical services, but also to invest in research, near and dear to my heart. By the way, those investments are giving us more insights all the time into not only better diagnosis, but better and more precise treatments for PTSD, for example. Speaking of PTSD, one of the most common conditions for veterans, that is, the best predictor of PTSD across many studies and across samples is, not surprisingly, exposure to combat. What about treatments, though? Well, thankfully, there are several very effective treatments that have been researched fairly thoroughly, with new research coming along all the time to refine them. These treatments usually focus on trying to process and confront the trauma that is the very source of the problem for veterans. The most common and effective ones are called prolonged exposure, trauma-focused cognitive processing therapy, and EMDR, eye movement desensitization and reprocessing therapy, all of which are available at Compass Health Network and similarly situated community behavioral health organizations. We also know that more intense combat exposure is consistently linked to suicide among veterans. As regards suicide, we know that members of the National Guard and veterans all have higher rates of suicide than non-veterans. In 2017, there were 28 veteran suicides per 100,000 people in the population, and about 22 suicides per 100,000 among active service members. Compare that with a general population rate of 14 deaths by suicide per 100,000. So twice as many veterans dying by suicide. Of course, we know that service members and veterans are way more likely to experience many of the key risk factors for suicide, though, including exposure to trauma, substance use disorders, and both familiarity with and access to firearms. We can't look at these numbers without hearing a clarion call to do more to reduce them, to save more service member and veteran lives. Thankfully, there's much going on in this regard that I'll share here in brief. Knowing the risks and challenges that veterans face, we need to recognize that access to and delivery of responsive, quality mental health services is a very important and effective means of reducing suicidal behavior and risk for veterans. We need to reduce and dismantle barriers to care, and promote the use of evidence-based therapies, ones that have scientific evidence of effectiveness. We know another effective means of reducing suicide is called means restriction, or making sure people don't have access to lethal methods for killing themselves, and generally making the environment safer for veterans. We know that use of a gun is by far one of the most common means of death for those who die by suicide. Now, these are difficult conversations to have in many cases, but we're doing it more and doing it better, I think. Really homing in on discussing firearm safety with those in treatment, and putting in place policies that can help address access to firearms and storage of firearms for veterans who may be at risk of suicide. I mentioned we would discuss some barriers to care. Well, certainly stigma surrounding mental health problems and receiving care for them remains stigmatized among military and veteran communities, unfortunately. Some of it is deeply ingrained in the system and not easily overcome. For example, let's think about the fact that revealing that one has received a mental health diagnosis or been hospitalized for behavioral health matters can and does jeopardize or even eliminate the possibility of obtaining certain security clearances needed for positions in the military. And it doesn't stop there. Some people think, well, what does the security clearance matter if you're a veteran? If you're no longer in the service, it's not as important, right? But if you look at what actually happens, it's clear that many veterans are going into post-service jobs that most definitely require some of those same kinds of clearances. For example, the first responder, law enforcement, and intelligence communities are full of veterans. So these concerns about the career impact or repercussions of getting mental health care remain a significant barrier, and a difficult one to overcome, I'm afraid. Another stigma-related issue that we can perhaps help overcome through education is a very narrow view of what mental health treatment actually is, what it looks like, and the diversity of treatment options available. One thing we hear about frequently from service members and veterans is that they're very concerned about the possible side effects of some of the most common psychiatric medications, from significant weight gain to sexual side effects. So we need to get the message out to veterans that there are many options, including non-drug therapies that are very effective, and that they are in the driver's seat with regard to their treatment. They can decide what they want and what they don't. But the message of hope is essential. Don't give up. Keep trying different treatment options until you find the ones that work for you. Very often it is a combination of treatments that works best, along with a solid, trusting relationship with a treatment provider and team. And we've talked about some dark things and some risks of service, but I'd like to close this episode with a look at the positive effects of military service that are possible and very common among service members and veterans. Clearly, for example, many veterans have been able to use and develop skills that they otherwise simply wouldn't have as a result of their military service. They've become battle-tested leaders, developing great leadership qualities that haven't been as well recognized as they should, perhaps. And of course, nearly every veteran to a person will readily tell you all the things that they've learned and all the ways that they've potentially grown from their experience. We're becoming more aware of the phenomenon not only of PTSD, but post-traumatic growth. People experiencing new and better ways of being as a result of traumatic experiences. There's a reason for the enormous pride and community these folks feel. The sense of meaning and purpose provided by putting everything on the line for a larger mission, a noble mission of protecting a way of life that's precious to hundreds of millions of us. Of course, we know that meaning and purpose are two of the most important protective factors against suicide and against many mental health and substance use challenges. So it becomes all important to find ways and means of maintaining that as the big transition happens from military to civilian life, right? Or transitioning to a new kind of meaning and purpose. We actually do know that overall our veterans are more engaged in civic matters and in community issues than non-veteran counterparts. That makes sense, as they tend to be mission-driven, purpose-driven people. As such, helping veterans to understand that though their military mission may be complete, many other missions and purposes await them, whether it be finding meaningful employment or leadership within their communities or reconnecting with their families. All of those are important things for us to help them with. Having recently attended a couple of veteran funerals with military honors for my big brother and my namesake nephew, a little over a year apart, I'm forever grateful for the way many vets have found meaning and purpose by supporting the families of our lost ones. They've done it with motorcycle escorts, special gifts, words of comfort and encouragement straight from the mouths of those who understand best. And even a couple of very special men. I'm looking at you, Josh Moran and Sam Kennedy, traveling across many states in a pandemic to put their battle buddy, my nephew, Michael Paul, to rest. Those experiences are now treasures for me and my entire family. I hope it's clear that I have great honor and respect for veterans, and that I believe all of us non-vets really do need to better recognize the value of veterans. I mean, how honorable, how selfless and other-focused of them, that they raised their right hand and served in very challenging times and very challenging circumstances and climates. So it's our job as non-veterans to raise our own awareness and recognition of the invaluable contributions veterans have made and are still making every day. Remember how I said finding meaning is one of the most important protective factors for veterans? Well, that's hard to do, and it's not a job they should be asked to do by themselves. By our recognizing and supporting them, we can help them find meaning. They'll find and be affirmed in their meaning, the why of their service, if we appreciate that service properly, perhaps. A sense of meaning can and will come from that. That's the real beauty of the importance. That's the real beauty and importance of Veterans Day. Not that some people get the day off, hey, thanks for that, but that we fully recommit to recognizing and valuing their service. That's what it's all about. It's about the non-veterans among us, including those of us with uniform envy, like me, recognizing the enormous role that veterans have played. Thank you.